Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Luntz. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's really great to have you with me. In today's episode, we're just going to be talking about prosthesis, either fixed or removable prosthetics, and that includes things like dentures, orthodontic appliances, space maintainers, partials, and dentures. And how do we treat our patients appropriately who present with these types of oral prosthetics? It's really important for us to understand the difference and then what our role is, what we do to support our patients who have these oral prosthetics. So, like I said, a fixed prosthetic is something like an orthodontic appliance, a tooth supported bridge unit that doesn't come out of the mouth, an implant bridge unit, some kind of space maintainer. These are things that are fixed in the mouth and do not come out on a daily basis. And then we have removable prosthetics, things like dentures and partials. And there are some space maintainers that are created that are removable, as well as other orthotic appliances that come out. And they're all made for different reasons to support the needs of a patient. So when we're talking about a fixed bridge is usually created to replace some of the natural teeth that have either been lost or never formed due to some kind of dental anomaly. And there's different types of fixed bridges. And you can even have an implant supported fixed bridge. So there are bilateral and cantilever types of fixed bridges. A bilateral fixed bridge is supported by one or more natural teeth on each end. So you would have a natural tooth that is prepped and covered with a crown on either side of what is called a pontic, and that creates the fixed bridge. A cantilevered bridge has two or more teeth that are prepped and crowned, and then the abutment or the replacement tooth is on one end of that cantilever bridge. So the cantilever is supported by one or more teeth only on one end. And then an implant supported bridge is you have a cylinder and a screw type of implant used for the abutments, and the abutments are used to hold the bridge in position. So maybe you have a natural tooth support on one side, the pontic is in the middle, pontic meaning the fake tooth that's replacing the natural tooth that was lost or missing. And then you have an implant tooth on the other side of the bridge. Now, I just want you to know that there are some criteria for a fixed partial or bridge. All the parts have to be accessible for the patient to be able to keep those areas clean. Also for the clinicians to be able to keep those areas clean so that we can support the needs of our patient. And then this bridge or partial will be long lasting for those patients. So we want to be sure that the bridge is accessible and cleanable for our patient and that there's no trauma to the tissue around these bridges. So for a partial denture, the support of a partial really depends on the location and how many remaining natural teeth are still present in the mouth, because the partial relies on the remaining teeth to get its support. So it might be some tissue, an alveolar ridge that is supporting the partial, and some remaining teeth. So there might be a retainer or clasp that hooks the partial to the natural teeth that remain in the mouth. And partials can be made of different types of materials. So you can have a plastic resin, alloys, gold, or chrome. And the teeth and gingiva that the partial is made out of can be porcelain, plastic, and you'll see resin and metal also used for these devices. As the dental care professional, we want to care for those removable prosthetics as well as the underlining teeth and the tissue that is underneath those prosthetics. When we're doing our health history, dental history, we always want to ask if the patient has anything removable, if we're not aware of the answer to that question. And then if the patient says that they do have a removable prosthetic, ask them to remove that item before the radiographs or some kind of oral inspection is done so that you can see the underlying tissue. Provide the patient with some kind of paper towel or tissue to help them with removal or inserting the item. You want to provide them with a little support here. When you're maintaining that prosthetic with the patient, you want to look at the radiographs for bone loss, infection, and really take a close look at the abutment teeth that these prosthetics rely on. Radiographs are still needed in edentulous areas, and it may be appropriate to take a panoramic x-ray. Now, remember that poor fitting dentures and partials can cause bone resorption. So it's really important for us to maintain the interval of those radiographs. It's also really important for us to be checking the periodontal pocketing for mobility and increased depth of these pockets for these retained teeth that we're relying on to provide support for those partials. So when we're using the remaining teeth to do the work of the collective, it's really important that those teeth remain healthy and that we keep a really close eye on them. Biofilm tends to accumulate more readily and in greater quantity on all of these different appliances. So don't be surprised if you see a partial or a denture or a bridge that has biofilm, calculus, and staining on them. This is completely normal. You want to provide your patient with ultrasonic cleaning for their partials and their dentures, and polish the teeth with a non-abrasive agent. Make sure that you are educating your patient on the needs and benefits of a fluoride varnish on the recession of the abutment teeth, and let your patient understand the real significance and importance of what those remaining teeth are doing to support them in their chewing, their eating, their speech habits, and all of the work that those fewer teeth are doing. Now, there's a couple of things that you want to keep in mind. Never scale a denture with a sharp hand instrument. And ask the patient how they're caring for their at-home stuff. What are you doing to take care of your denture? How are you maintaining the health of your partial denture? This is really important for the patient to understand that there are some things that they should be doing. Now, as the clinician, we never want to leave the partial or the denture lying out on the tray. We want to keep it in a blue cup with a Ziploc bag. We want to keep it moist. And we want to look for any wear spots and ask the patient if they're having any problems or they're getting any sores. I always like to take the denture and hold it up to the light because that will show me if there's any thinning areas and if there's a wear spot on that particular denture, maybe an area where the patient chews a lot. So keep in mind, there's a real transition for patients when they first get a partial or a denture or even a bridge. The tongue takes some time to adjust, and all of the muscles and everything takes some time to adjust. Your patient may say to you that the denture makes it so that their food doesn't taste as good, or that they're having difficulty with their speech. Now, keep in mind, it can take up to a year for a patient to adjust to having a prosthetic inside of their mouth. And I think that patients need to be really aware of this before they decide to remove teeth and go this route. It's really important for us to educate them, especially our patients who are gaggers. They tend to take a lot longer to adjust to having something foreign in their mouth. And for those patients that have a real challenge with things like a gag reflex, I would tell them to start out by wearing it a couple hours a day and one meal, and then increase it over time. Do kind of an intervaled interruption or change. Now, it might be a strange thought to think that our edentulous patients need to make a visit to be seen at the dentist. Why do we need to look at these patients if they don't have any remaining teeth? And oftentimes our patients need to be educated on why they would still need to keep an appointment for a routine exam with the dentist. It's really important for us to look at the condition of the tissue, check for oral cancer, check the fit of the denture, determine if there's any need for repair or replacement, find out if our patients need support with their biofilm control, and then their overall cleanliness of their mouth to really help them with their oral health and overall health status. So the recommendation is that our edentulous patients need an exam once a year. This is something that we want to educate our patients on if they are going to become an edentulous patient of record. It's important for us to share with our patient that after each meal and before bedtime, they want to rinse and brush their partials and their dentures. And ideally, they should do some kind of chemical immersion on a daily basis and not to sleep with their denture in their mouth overnight or their partial because their tissue needs time to heal. Now, when we're talking about implants, implants are a little different from conventional dentistry because the implant replaces the root of a missing tooth, which is so great. And it has become the standard of care. Now, fixed bridges require removal of enamel from abutment teeth, and fixed bridges can become uncemented. And the other thing is when you're replacing a single tooth by using a fixed bridge, you're now impacting 3 teeth. You're impacting the tooth that it's replacing and the 2 adjacent teeth. And so this is why implants are so wonderful. If you lose 1 tooth and you can replace it with an implant and you're just putting it in that one space without impacting the 2 adjacent teeth, it's a win-win for the patient. And then down the road, if something goes wrong with that implant, it's not impacting 3 teeth. So this is just a benefit of why implants have become the standard of care. Now, when we compare an implant to the option of having a partial, a removable partial requires a mechanism to attach to the remaining teeth. It needs some kind of clasp. So a removable partial is still relying on the strength and integrity of the adjacent teeth. And so replacing that tooth with a partial, you're still putting all the chewing forces on the adjacent teeth instead of placing an implant and putting it back on that single area where it was when there was a natural tooth. And with those partials, the clasp can loosen, the natural abutment teeth increases the risk of root caries. So anytime you have an appliance in your mouth, there's a greater risk of biofilm accumulation and the increased risk of root caries. The other thing is that a partial that's not fitted correctly may rock back and forth and result in a periodontal issue with some of those remaining teeth. And removable prosthetics can accelerate the bone loss. So you can see how some of these important facts related to implants are so wonderful. So cases have been lost where implants have not been offered as a possible treatment plan. So litigation does occur. We want to present our patients with all the treatment plan options. Make sure that the patient understands that implants are an option, partial dentures are an option, and bridges are an option, and go over the pros and cons of each. Success of an implant for a patient will depend on their home care and their routine treatment that is supported by the hygienist and the dentist. And it's also important for you to know as a student that only plastic instruments and implant-specific instruments should be used on those implants. And we want to make sure that we are helping our patient with biofilm control around those implants. We want to treat inflamed areas just how we would do around any tooth. Check for mobility. Even without bleeding or inflammation, this could be a sign that the implant is failing. And it might be decided that a patient with an implant may need to be seen a little more frequently, or a patient with partials or fixed bridges, they may need to be seen a little more frequently than someone without any of these items. Now, there's home care recommendations that we can provide our patients who have these fixed bridges, implants, removable partial dentures, all of these different things. We want to get really knowledgeable about all of the different oral irrigators, some of the non-abrasive dentifrices that are out there, the different fluoride options for patients, some of the interdental aids, some of the prescription strength fluoride for those abutment teeth. We want to make sure that we are very well versed in what to give our specific patients for at-home needs and what types of brushing techniques that we want them to have, with the whole objective of helping them support themselves in controlling infection, preventing bad breath, maintaining the natural teeth, and longevity of some of these prosthetics. Some of the things that our patients have the biggest challenges with is removing the denture or partial at night. and then brushing the denture under warm water, things like that, and how to floss and brush around their implant. Oftentimes, patients get a little reluctant to do these types of things. So these are things that you want to be really good at talking with them about, because we want to make sure that we are helping them control their biofilm and maintaining the longevity of some of these teeth. I hope this was helpful for you guys. Know that your patients rely on you to guide them through the process, whether they're making a decision to go with an implant, a fixed bridge, or a removable partial denture. It's really important for you to share with them all of the information of what you know, the knowledge you have, to help them make the most informed decision. And then based on whatever decision they decide, you are there to support them on maintaining the health of whatever appliance they decide to go with to replace a missing tooth. I hope this was helpful for all of you. Enjoy your day, keep plugging forward towards your dreams and goals, and be sure to reach out if you need anything at all. Thanks, guys.